with experience working in immunization.
Yes.
That's a long road. So I can't compete with you for the position.
Oh, you can try.
I now have to go and acquire the qualifications. Now come and gain experience. No. By the time I am done, my retirement age will have passed.
Okay.
Yes. Nice to have you in studio.
Nice.
Okay. First of all, before we even go to, but first let's start, because yesterday it said you launched the HPV vaccine.
Yes.
Let's start from the HPV vaccine before we come to what it does. So what is the HPV vaccine?
So it's a vaccine that prevents you from getting HPV.
Okay.
And HPV, I'll take us there. HPV is the human papilloma virus.
Okay.
And it's a virus that is spread through close skin-to-skin contact, particularly through sexual intercourse.
Okay.
And what we found is that there are various types of HPV.
Okay.
But the ones that we are most concerned about are the type 16 and type 18, because they cause cervical cancer.
Okay.
There are other types of HPV that cause cervical cancer as well, but they are to a much lower degree. So the vaccine we are given targets the virus that causes about 70% of cervical cancers in the country.
So this particular vaccine targets the virus that causes about 70%
of cervical cancers in the world. Yeah.
Okay. But you said human what?
Papilloma virus.
Okay.
It's a mouthful.
Okay. But you're saying that, so even this vaccine does not target all the diseases it causes, or?
No, so the vaccine we are given targets HPV type 16 and 18.
16 and 18.
Yes, and it also targets HPV type 6 and then 11.
Okay.
And type 6 and then 8.
Okay.
The challenge is that those other types cause a disease we call genital warts.
Okay.
I don't show the pictures. I'm sure if you don't Google that's also. If you Google, you might not be able to eat this morning.
Okay.
So it's another disease. That's a genital disease.
Okay.
And the vaccine we are given targets these things. And basically what we are trying to do is we want to make sure that our girls aged 9 to 14 years, who are the age group in which the vaccine works most optimally, are the ones who receive the protection, so that in the future they wouldn't go and develop cervical cancer. Okay.
So now let's come to cervical cancer.
Yes.
What is it?
It's a cancer of the entrance of the womb. That's the cervix. And it's in a very delicate place because you won't see the cervix when you just look down. You have to actually open the vagina and then see the cervix in there. And unfortunately, cervical cancer in the early stages is asymptomatic. Girls or women don't have any symptoms. By the time symptoms start to develop, you would have already had quite advanced cancer. And it's the second most common cause of cancer in Ghana. Women.
Okay, second most common cause of cancer in women.
Yes.
You're saying that by the time you start seeing the symptoms, it's already advanced.
Yes.
Wow.
So what happens is that we advocate for screening.
Okay.
So if you do the screenings per whatever schedule you have, WHO advises that every woman between 35 and 45 should have at least 2 screenings. I'm saying at least 2 screenings because of some of the questions that are coming. 2 screenings. And when they go and screen and they find what they call precancerous lesions, that is, they find that the cervix has some lesions or abnormalities which are not necessarily cancer yet, they can actually cure it. And when it's seen early as early cancer also, we're able to cure. But the challenge is that most of our women are coming in at stage 4 and 5, which are quite advanced. And in fact, in Ghana now, if we get, let's say, we get about average 3,000 women getting cervical cancer per year. About 70 to 80% of them die within the first year because it's quite advanced.
70%?
70 to
80%?
70, yes.
So this is fatal?
Yes.
For most women?
Yes, currently.
Okay, so explain to us what causes this, the cervical cancer?
So the high or the vaccine or the virus that causes most of it is HPV.
Okay.
We've also found that a few other things also lead to cancer. Things like alcohol, excessive use of alcohol, and then smoking. Those are other smaller bits that time. But the most common thing about the virus that causes 99% of the cancers is HPV.
So, and that is, you said that's sexually transmitted?
Yes.
Wow. Why is it difficult to detect in the early stages?
Because there are no symptoms.
That's Why? Because every disease that is very fatal.
It's easy. That's why. So you see, with the cancers, we now do a lot of screening. So this month, for instance, we are doing a lot of breast screening because by the time the symptoms will show up, you have gone far. So for the cancers and things, we advocate for screen. So that almost every cancer that we have good data with age group and things, they have screening schedules for them. So cervical cancer, I said WHO says by 35 to 45, you should have at least 2. Breast cancer, we are saying every time you have your menses, you should check. Like these are all screening schedules because if you wait for it to tell you announce its presence, it has already gone far. That's the challenge with it. But the men too, what I would say is that the men too don't think that you are home free. See, you're smiling. The men also do have the HPV. And in the men, it can cause penile cancer and anal cancer as well. In fact, in women, it causes anal cancer as well. But commonly, the men, it causes penile cancer. And HPV in a man, just HPV by itself will not have any symptoms as well. So you have to go and screen.
Wow. So, but are there any signs and symptoms you can see in the early stages that perhaps should give you an indication?
HPV?
Yes.
HPV has no signs and symptoms. Nothing.
Nothing at all?
At all.
So, your advice is screen?
My advice is that let's get our girls immunized first. So, the 9 to 14-year-old group.
9 to 14.
Let's immunize them. Then also, once you go, those who are outside that age group who are not being captured by our program should go and have the screening done. When you are screened and you are negative, you can go and subsequently go and buy the vaccine. It's available in various places for sale. Let me emphasize that our vaccine is the vaccine we are offering for free is for girls 9 to 14. Those of us who are outside the 9 to 14, me like this, I'm currently like 50 years. I'm 15. I have to go and buy the vaccine myself. My parents have to buy the vaccine for me. So basically, that is what there is for that group to prevent cervical cancer.
So beyond 14, you can still take the vaccine?
Yes.
But you have to pay for it?
You have to pay for it, yes.
So as we speak currently, you're saying you're doing... So now that... so explain to us what the launch yesterday means and how do you get the vaccine admitted for those who are the potential beneficiaries?
So yesterday's launch was actually something that has been in the works for so many years. Ghana has done a number of pilot implementations in this since about 2013. And we have, in fact, let me say, we have a cohort of about 44,000 girls across the country who have taken at least one dose of this vaccine since 2013. They are in various districts. But that is 2013. That's about how many years now? 12 years now.
Yes.
So it's been there. After that, because it wasn't rolled out nationally. The expectation was that it was supposed to be rolled out nationally, but it wasn't done. So it's been available in the private sector. In fact, I don't want to mention any particular place, but there are places within this country that if you go and screen for HPV and you are found to be negative, they offer you the vaccine for sale. So it's been available since then. People who have money are able to buy it. So that has been the biggest barrier in the country. It means that it's available, but it's not, people can't afford. So now the government has come forward and then put in money to ensure that we're able to target and be able to provide it to everybody, irrespective of their ability to pay, which for me is a very big thing. Because the people I think who need it the most are those who do not have the means to be able to purchase the vaccine. Because other risk factors for the vaccine, for the virus, are things like early sexual intercourse and then multiple sexual partners. And people who don't have a lot of money, we tend to see that they tend to trend towards early sexual intercourse and more sexual partners or partners with more partners. Because if you are somebody who doesn't have a lot of means and your partner is all over the streets, as they say these days, and you don't have means of going, you stay there, and the partner will go and bring you whatever they go and bring you. So these are people that people typically can't afford. So with the government being able to provide the vaccine is good for us. And the minister launched it yesterday just to tell us that government is truly committed to this process to make sure that the vaccines are available. We are giving them in schools currently, but after this week, after Sunday, they'll be available at all our weighing sites. So anywhere that we offer the normal, what we call weighing visits or immunization to children, you can have the vaccine for them. And it's also free as well.
So you are starting with the schools?
Yes.
Going to schools and offering 9 to 14?
9 to 14.
9 to 14. Girls between the ages of 9 to 14 can benefit from it. And then you said subsequently to be available at the...
weighing sites.
where
the nurses come.
Newborns. Okay.
When the newborns get away, yes.
Okay, you can go there and get your girl vaccinated.
If your girl turns 9 years, you can take her there and they would vaccinate her.
I see. But you said something about, okay, so how many doses of the vaccine do you need?
We are giving 1 dose.
1 dose.
So when it first came, the research said we should give 3.
Okay.
And this vaccine has been in use since 2019. In fact, it was developed in 1994. But it's been licensed in the world since 2006. What is 2019? It's been licensed since 2006 across the world. And since then, when it first came, they said 3 doses. But as the years go by and they look at the research, they did 2 doses. And now we found that even 1 dose is effective.
Okay.
Which is good for us, because obviously if you are going to get people to do 2 doses or 3 doses, it's more difficult to follow them up to get. So the 1 dose is enough. We found 1 dose is enough to provide the protection the girls need.
Because you mentioned is it 27,000 that were...
About 2013, there were about 44,000 girls.
Okay. So from the science now, they are safe.
Oh, those girls are safe. We still need them to go and do the screening, because I mentioned that we still have other things that cause it. So you can go and take our vaccine, all right. But if you are there drinking or you are smoking and all this, these things independently by themselves cause cancer. So if you do engage in some of these other risk factors, you could still get cancer, but it wouldn't be from HPV.
Okay. Very interesting. In fact, you've scared me this morning. The numbers are quite scary. Because the things you said, so you're talking about the fact that it's difficult for you to see. There are no signs and symptoms.
No.
So if you start seeing signs and symptoms, you're already way advanced.
You are gone far.
But when you're advanced, is there a way to which you can be helped?
So
can it still be cured?
Yes. Cured, no.
Okay.
So they treat you and there's management. Okay. And depending on the level at which you are, we may look at improving your life. So improvement in quality of life. Sometimes there's what we call palliation, because if it's quite advanced, it's already gone to your brain, your liver and all those things. We try to make your life comfortable.
Okay. So
maybe give you pain medications, prevent if it's some mechanism to help be able to live your life a bit better. If you need a catheter, they'll put a catheter in. If they need to do a surgery to do something, they'll do all these things to make your life comfortable and to, in quotes, ease your passing without pain. So that is at the advanced stage. If you come early, there are things we do. We're able to do surgery, depending on where the level of spread. Then we do radiotherapy, because if it's already gone to the bones, we'll definitely have to use radiotherapy to try and target them and target the other place where the cancer may be. There's also immune therapy, which it's like an injection, but that is extremely expensive. And let me say, it's out of the reach of the average Ghanaian.
Okay.
So unless you have a lot of money to go and do the immune therapy, it's even outside the country where it's more readily available, it's quite expensive. So these are available. So we look at, you balance it all, and these are just the direct costs. Then let's look at the indirect costs, which a lot of us don't look at. A woman with cervical cancer will need someone to take care of her. Okay. If she has children, she will be able to take care of those children. She will be able to work. So there's costs. There's already economic cost to the home. Okay. Somebody else take care of her. That person may not also be able to work or may have to be paid. Hospital visits, there's time involved. You need to change your things. And these women today, they tend to have a lot of stigma, because by the time the cancer becomes quite advanced, they tend to start producing a very offensive discharge. Okay. Very offensive. Sort of like something that is dead. Dead, decaying matter. So imagine you can't be in a room with her. She'll be in the corner by herself. And if you're in the corner by yourself, you yourself, can you get mental health issues? Because now you'll be depressed. And how many of your children may not be able to come to see you there? It takes a toll on not just the woman, but on the family as well. So those are all indirect things that come with cancer, which we think that is not acceptable in 2025.
You were talking about those who are most at risk.
Yes.
Of contracting cervical cancer. Yes. Go through what are the risk factors? What are the things you need to watch out for and know that perhaps I need to do some screening urgently?
Okay, so first of all, people who start sexual intercourse early.
Okay.
If you are not an adult, if you are starting before you are an adult, you are at risk. Okay. If you are somebody who has multiple sexual partners, you are at risk. If you are somebody who has, let's say you have one sexual partner, but your sexual partner has multiple sexual partners, you are also at risk of it. If you are somebody who takes in alcohol, you are at risk. If you are somebody who smokes as well, you are at risk. Okay.
So what will be your advice what's your advice in terms of prevention?
Vaccinate your girl child. if you're an adult, you can also go and screen and take the vaccine if you are negative. I'm saying if you are negative because it's likely that you may have encountered it already because you may have already had sexual intercourse. So if you go and you are negative, you can vaccinate against it. That is fine. But for us, our primary concern now is our girls because other countries are on their way to eliminating HPV. Denmark has done very well. Sweden has done very well. And if you look at their populations, now HPV is almost non-existent. And it's all because of the concerted effort for vaccination. Australia too is doing quite well with vaccination. So the thinking that it is a vaccine being brought to Africans is not that. And some people are saying that they should introduce it in America and the rest. It's been introduced in America and Australia. In fact, a lot of European countries have it already. So in a way, if you look at us, we who can't afford, it's not that it's coming to us to come and help us. So it's very important that we vaccinate our girls. I also use this medium to state that the vaccine has no effect on fertility. It doesn't do anything for your fertility at all. We have girls who have taken it and some of them have had children. We have a documentary we had. Some of them are married with children and they are living their lives normally. So the vaccine does not have any long-term effects. What we found is that sometimes you may have pain and swelling or redness at the site. Some people may have dizziness, drowsiness, abdominal pain, headache. If you take the vaccine and you feel not well in any way, please go to the nearest public facility and mention if taking the vaccine, you'll be taken care of for free. So the vaccine is very safe. Yesterday, the deputy minister took it there for people to see, just to show that we've not brought you in quote something that will harm your daughters. She wasn't eligible to take the vaccine, but just to demonstrate its safety, she took the vaccine for us to see, and we all saw what was given to her. The box was shown, the vaccine was shown, it was drawn for people to see. So it's not like we've bought some special thing for her and other thing for other people. We are using the Gardasil, and that is the same vaccine that is being administered all around the world.
You've already said that if you're screened and you are negative, it means the vaccine will not help you in any way.
No, I didn't say that. I said if you are screened and you are negative, you can take the vaccine.
Okay, but if you're positive, what happens?
If you're positive, if you're a woman, then you have to go and then they'll put you on a schedule of screening, just to make sure, just to see if and when the virus will turn into precancerous lesions. So if you test and you are positive, you have to be on a screening schedule. I can't tell you offhand what's the screening schedule because it has to do with age and a whole lot. There are a few complications with that, but they'll put you on a schedule for screening and you have to adhere to the screening schedule. So that just in case, it means that you have it. So we have to monitor it to make sure it doesn't develop into cancer. And if we start seeing any changes, they will know what to intervene. But we cannot treat it. Once you have it, we can't treat it. As in the virus.
Are there particular groups of women who are not supposed to take it?
Yes, so any girl who is pregnant cannot take it.
Okay.
Any girl who is seriously sick cannot take it.
Okay.
And also, if there is any girl who, I told you there's some cohort of girls, they are even old because those people, they are like, that they took it around like 13, 14. And they are probably like 20 something. But if you've had anybody who has been exposed to the HPV vaccine in the past, I told you some people used to give it as 2-dose schedule before. So if somebody took one, for instance, and is still within the 9 to 14 years and had a reaction to it, please, they shouldn't take the vaccine.
Okay. So pregnancy, no.
No, please. Currently pregnant, no.
Don't go there.
At all.
Now, we just joined us. We're having a conversation with Dr. Selorm Kutsoati, acting program manager, expanded program of immunization, Ghana Health Service. I'm looking at the various portfolios that come before me. I want to see which one I am most likely to to qualify for. Clearly, I'm not even in her league at all. The league at all. Anyway, let's conclude by one, your message, and then two, why do I need to get vaccinated? Yeah.
So my message is that all parents with children who are eligible should avail them to be vaccinated with the HPV vaccine. Okay. And the reason is that you are making an investment in the life of your girls. Okay. Over the years, we've been giving our children various immunizations and they have prevented outbreaks. Okay. And we've seen the effect of it. I think that's probably one of the problems with immunization. Okay. When you work very well, people don't realize that you are working again because now the system is at equilibrium. Okay. So let's make sure that we don't have our girls developing cervical cancer in the future. So let's get them to vaccinate. The vaccine is safe, it's effective, and it does what it sets out to do. So parents should be rest assured that we are giving them something that has been tried and proven and has been registered in the country by FDA. We trust our FDA to do the work they do. And they have certified this vaccine for over 10 years. So let's take our girls or let's let them be vaccinated during this exercise and in the subsequent period when the campaign is over.
Okay. So you're saying you are currently in schools for how many days?
We started the injections yesterday.
Okay.
We'll be there till tomorrow. And then Saturday and Sunday, we'll go into the community.
Okay.
So we are going to churches, organized groups, and things like that. We've already spoken with some of them.
Okay.
So we'll be in the community looking out for the girls we couldn't get during the school period. And after that, the vaccine will still be available. So as I said, it's not like the vaccine, when we finish, like the campaigns we do that, we go away, we don't come back. Okay. The vaccine will be available. So even if during this period, you're unable to get it, you can still get it at our immunization centers.
Are you seeing any pushbacks?
Oh, I'm seeing a lot of theories, which is why I'm trying to clear the air. That first of all, it's not a new vaccine.
Okay.
People think it's a new vaccine. Secondly, it's in use all around the world. So it's not something that was brought specially for Africans to depopulate us. Thirdly, it has no effect on your fertility. This is research that has been done. Anybody who does the research can tell that there's no effect of that on the fertility at all. Those are the three common things we are finding. We are not testing it on Ghanaians at all. This vaccine is in use. I said I didn't want to mention the facility, but there are facilities here that if you work there with your money now, they will test you and give you the vaccine. And you pay. So it's already been here for so many years. So it's not something that we are now bringing into the country as a new thing.
And let me conclude by asking, you were talking about the fact that there are some countries that has been able to, in fact, is it
almost eliminate.
Almost eliminate. What's our target? Are we working within a certain target in terms of getting to that point?
So for this campaign, we are targeting up to reach about 2.5 million girls.
Okay.
Within this campaign period. Subsequently, we'll be targeting our girls of the the 9 to 14 year group. Okay. But we are looking at possibly when you turn 9. So in our mind, we are saying that we are going to pick 9 to 14 for now. Okay. Then after the campaign, anybody turning 9 can come. But we do know that some girls will not come. I mean, some parents I know they are waiting. They are doing watch and see to see if somebody will take it and collapse. So nothing is going to. I assure you that nobody is going to take it and collapse. After the period, we are looking at about 400,000 girls every year to take the vaccine, and it's going to be forever. So it's not going to become. It's not something that's going to come and at a point in time we are going to take it out of our program. Actually, no. It's going to be an integral part, like how we give our normal what they call abitipania, the injections we give on the arm and things. Yes.
Okay, so it ultimately become the group of vaccines that you give.
It's part of our routine.
Okay.
Yes.
Okay. Doc, thank you.
Thank you very much for having me.
Thank you. And it was nice to see you.
Nice to see you too. I appreciate this time.
Yeah. Dr. Selorm Kutsoati is Acting Programs Manager, Expanded Program of Immunization, Ghana Health Service. I was trying as much as possible not to sound too heavy. And of course, the message is simple. Take your girls 9 to 14. If they are in school, encourage them to take the vaccine. If they are with you currently, they'll come into the community, bring them and let them vaccinate them against cervical cancer, HPV. We have all stuck with the HPV because we don't want to commit ourselves. This is still a good morning conversation.